The big questions about funding, which is another one of those building blocks of building a system of care, is how can we promote a public health model? How can we promote promotion, prevention, intervention? How can we look at this as a population-based issue that we really need to make sure that we're promoting mental health, not treating mental illness? We need to develop a whole different finance model. How do we consult and provide technical assistance to early childhood providers and get paid for that? How do we screen all children for social and emotional issues? Well, as I said before, this is the Vermont story. This was the Vermont story in 2000, 2004, and between that period. We came up with answers for those problems. The problems we came up with at that time, in that place, in Vermont, are not going to be your solutions, but we came up with solutions. What we did was we found out that the codes, there was a code, V code for DSM-3 called parent-child interaction. Well, there were a couple of people that were talking to me and said, we've been billing parent-child interaction, the V code, and we're getting paid for it. And I said, that's interesting. And then I called an agency in another part of the state, and I said, would you do me a favor? Would you build the V code for parent-child interaction and see if you get paid for it? And they did, and they said, we got paid for it. And so we said, okay. I went to the Medicaid agency, and I said, we're aware that you pay for V codes, but we have a very specialized service that we want to focus on these individuals being able to pay for the V code and be able to get paid for it. And I said, great. And they instituted a policy that allowed that. And so all the people that were worried about having diagnoses for young children built V codes. And we were able to triple the amount of money of the grant by taking all of the various services that were provided in the early childhood system of care that were Medicaid eligible, that were not being billed, and we doubled and tripled our pool of funding. That funding allowed us to pay for a lot of the consulting and a lot of the services that we didn't have. That was during the grant period. After 6 years, we went again to Medicaid and we said, these people that you allowed the V code for, what we would like to do is create a class of people that could bill consultation and education without an identified patient and do the C&E code. And but it's only these people in this class. And they said, okay. So we ended up being able to get these services paid for. It was a Vermont solution. It was people standing on each other's shoulders. And the other part of sustainability I want to tell you was that our grant funding ended. We went into the legislature. We're supposed to go into the legislature. And everybody before the legislature got started, each of the 12 communities had legislative breakfasts with their legislature. And they said, they showed them what work is being done, all the different agencies, the parents and everybody, and they told stories. I did not get called into the legislature and was awarded $1.5 million to continue the grant through general fund. So this was the power of building constituencies, of kind of getting people together and going through that kind of a process. The evaluation, very basically, I just want to say that the significant, again, this was about, the evaluation was about intervention. And it showed in 6 months that there were positive reports of behavioral changes, and what was most important was that parent stress was reduced, and that as parent stress was reduced, the child's problems decreased. It wasn't the other way around. and that parents were very satisfied with their child's services.